Hello, folks. Welcome to my channel. Welcome to my brain wreck. Hence to the area, my brain has a wreck. In other words, I have seizure disorders. So, as you know, this is my little disclaimer out here. I just provide stuff and information out there. This is not for to take as medical advice or anything like that, or take it to heart or anything like that. If you need medical advice or anything, you go see your medical personnel, medical teams, such as your neurologists, epileptologists, or your doctors, whichever medical team is providing. So, today, sorry about that. Today, what is the difference between a neurologist and an epileptologist? Well, we're going to talk about that here in just a moment. And I'll explain to you what it is and why it's important to have one or the other, or just one. Basically, a neurologist is a medical doctor in diagnosing and treating diseases of the nervous system, including the brain. Hence, my brain wreck. They're often the first point of contact for individuals experiencing seizures. They can further specialize in epilepsy. I myself have not been diagnosed with epilepsy, but I do have a doctor's appointment here tomorrow. So hopefully, this is a different neurologist I'm seeing. The other one, he was just way too quick. Very nice guy though, but very nice. He was just so busy and just didn't take enough time with me. In my personal opinion, but he was great. He was good. He just has so many patients dealing with things. So neurologist plays a crucial role in diagnosing the cause of the seizures, determining the type of epilepsy. F apical. All right, so F apical. Now they say if you have two or more seizures, I guess that's epilepsy. I'm not sure how it's for it. Mine are nocturnal seizures, so they happen when I'm asleep or we're just waking up. Whatever. Those are considered one of the most deadly. I believe they're called tonic-clonic. Don't quote me on that because, like I said, I'm not an expert. That's not my field. In my field, my field is in criminal justice. All right, so guys, I'm in criminal justice. Please go right ahead. So, which may include medication or other therapies. Develop a treatment plan. So, thankfully for my PCP right now, he's very kind of that he prescribes my seizure medicine. So, and actually they can surprise seizure medicine. Sometimes they don't like to because they would prefer you to see neurologists. That's more of their expertise. But your doctor can prescribe something if he feels comfortable to. And thankfully, mine does. He's a DO, so he's on both sides of the medical side and the science side of things. So it helps out, I think, personally. So basically, a neurologist, what they're going to do is conduct an evaluation, including a neurologic exam, medical history review, what kind of history, potential tests like an EEG, which is an electroencephalogram to assess your brain activity, which I've had done one time, just once. But like I said, they didn't really see nothing, found anything. This was more of a sleep study. All they found out on me was I had periodic leg movements did like 70 movement an hour, each hour or so. But they didn't see anything else. So it's also apnea too. They can do things like apnea, a sleep person or a pulmonologist. So sometimes that can be connected to your epilepsy, from what I understand, from what I've seen in my research and stuff. But I could be wrong. I've done some research in my family, but I've talked to my mom, my family, and my dad. I still have to talk to my dad, but unfortunately, my dad is how you put it, Alzheimer's or dementia shows a lot of signs of it worsening. He would not know, so he has to be taken care of, unfortunately. So, and thank you for my sister for taking care of him. So that's very kind of her. So, like I said, they can do a thorough evaluation, including a neurological exam, a medical history review, and then potentially test like a EEG, as I mentioned, to assess brain activity, determine the seizures are present and what type they are. They may not be shown there at all. So this is according to the Epilepsy Foundation and Johns Hopkins Medicine. There are epilepsy specializations. Most people are called epileptologists. They have a little bit extra school and training in that, and they go, and they can further dig deeper into stuff like that. So, epilepsy specialization. While neurologists can handle a wide range of neurological conditions, some specialize in epilepsy, also known as epileptologists, which is the study of epilepsy, obviously. And further, they can study more of the brain stuff and what causes, providing focused care for individuals with seizure disorders. And you can find that also on the Epilepsy Foundation, also. Now, as for treatment, neurologists prescribe and manage medication regimens to control seizures. That's according to the University of Rochester Medical Center. They also may refer patients to other specialists like neurosurgeons for surgery. And then sometimes they put what's called an RNS or a VNS in, And I said I was going to get into that in one of my other videos here or whatever. So, or therapists for behavioral interventions, because sometimes there can be psychological conditions and stuff like that that can cause seizures, I believe, or what some. It could be also from medications. Hard to say. Now, ongoing management, of course, neurologists often provide ongoing care and management for individuals with epilepsy, adjusting treatment plans as needed, and monitoring for any complications or changes in seizure frequency or severity. Now, as for my appointment tomorrow, hopefully we'll give me do some stuff here. Maybe he'll give me maybe he'll be able to give me a 3-day hospital stay. Hopefully, whatever. I would prefer that if he's willing to do that. Mind you, this doctor is an older doctor, so, but he's the one that seen me when I was admitted to the hospital and told me not to go back and didn't want me to go back back to work at all. He felt it was very unsafe for me to do. So now this doctor is older. He graduated from medical school in 1978, so that gives you an idea. So, but he's very nice and very professional and courteous and has great bedside manner when I was there and with my wife. So, unfortunately, I don't even think I really remember him hardly at all. But he is an Indian doctor, but I've always loved Indian doctors. They're great. I think they're pretty awesome, personally. But it's crazy of what the brain does to you. So now, if you are diagnosed with epilepsy, your primary care physician may recommend seeing a neurologist as your first step, obviously. So if you guys ever got diagnosed with a seizure or anything like that, whatever, ask your doctor, is it best to go see a neurologist? More likely you're going to see a neurologist first. But depending on the type of the seizure and stuff like that, if they see something totally different, they prefer that you see Epileptologists because of more specialized training and stuff in that. And as I said, you might benefit from seeing an Epileptologist. It's basically a neurologist specialized in epilepsy and seizure disorders. They have more schooling and training in it. So now if you have difficult to control epilepsy, an Epileptologist, the Comprehensive Epilepsy Center, can help, CEC, basically, Comprehensive Epilepsy Center, There might be some in your state, might not be. And I think there are some certain hospitals, different hospitals and stuff, more like your level 1 trauma centers and stuff, more likely to have those things like that. Now, I know at first, experience your first seizure can be scary. But like I said, I don't remember none of my seizures at all. I have 4 of them. My last one was a pseudo seizure, which I don't know how it was brought on. I don't know if it was from stress or whatever, but I did something. I don't know what. I can't remember jack nothing or anything like that. So seeking epilepsy cure, basically. So experience your first seizure actually can feel scary and confusing. You may have more than one kind of seizure, and your seizure triggers may vary. It can vary from lights, flashing lights, stress triggers. Your medicines even maybe cause them. You don't know. Now, who do I see for a seizure diagnosis? Well, you got to have tests and stuff like that, and that's why they send you to a neurologist. And then it says, do you call your family doctor, neurologist, or another specialist? Well, you call your doctor first, let them know, and they'll probably recommend a neurologist for it. And then what type of doctor treats epilepsy? Obviously, a neurologist does. How is epilepsy diagnosed? Well, epilepsy is done by a number of tests. One of them is the EEG. Some will do 4 days, some will 5 days, and 1 day. That's what they try to do. I know it sounds very scary. They try to induce seizures just to see where it's coming from. Does it come from your frontal lobe, your left frontal lobe, come from the back? It's coming up here. That's how they get to treatments and stuff like that. That's why some people, like I said, have what's called an RNS or a VNS. In my next video, I'll do put the VN. I'll show what the difference between RNS and VNS, whatever it is. I'll talk about that. And I just want to mention again, I'm not a professional. I'm not a doctor. I'm just passing out information from what I'm learning and stuff for myself, since I do have a seizure disorder. Never thought I would at 48 years old. Now I'm 50. Luckily so far. so far so good. So, but I still want answers to see what causing. Sometimes I believe infections. I had an infection I didn't realize I had. I'm not embarrassed to say it was cellulite infection on my, I won't say on my backside here. Didn't even know it was there or anything like that at all. Not one bit. Didn't hurt. Didn't feel better. Didn't hurt or anything like that. I know because it was right in the spot where there was no nerve or what. It's hard to say. Now, most people, those, of course, are going to receive seizure care for the first time in a hospital emergency room. I, the first time I had a seizure, I was supposed to be admitted, but nope. Guess where they kept me in emergency room for 5 days. So you're going to, you're probably going to turn first to their primary care provider for answers, right? And then your primary care, your PCP, or your general practitioner, wherever you may live. I live in the United States, so I have a PCP, and I know in England, I believe they're called general practitioners. I believe that's what they're called. I'm not sure how, I'm guessing, but your family physician, your pediatrician, or your nurse practitioner may be able to diagnose epilepsy based on your medical history and symptoms, but more than likely, you're going to want, not your doctor, more likely you want a neurologist to diagnose that part, because it's more is where they neurologists are experienced, obviously, or epileptologists. So, as I said, your provider may recommend a skill such as a neurologist or epileptologist or epilepsy specialist. Both types have specialists have extensive training in conditions that affect the brain, including epilepsy. They also have a valid, of course, they had to have a valid state medical license and complete ongoing medical education. I don't know if you guys real nice that if any type of new treatment and stuff is found out or stuff like that, or is given as an approved and crossed through, doctors have to go and they have to understand the training, what's and how to use it and where to use it and who to use it on, I believe, is what they're supposed to do. Now you wonder what the training is for a neurologist. So basically general neurologists and doctors who focus on disorders of your brain and nervous system. They treat many conditions from Alzheimer's disease, a stroke, to concussion and sleep disorders. So they do not perform surgery like neurosurgeons do. So there's a difference. Neurosurgeon is obviously way more trained like that. People that look up on their brain sometimes. And I've seen stuff for surgery for people that have seizure and stuff, and I've seen where they show, their brain cut open and stuff like that. Not their brain, but their scalp cut open, stuff like that. Now, mind you, I know it sounds funny. You don't have filling up in your brain or anything because there's no nerve systems connected. There's cells and stuff, but no nervous system. I don't know how to explain it, but you have to look it up. Because they can do like a twilight thing on you or whatever, and have open there. Maybe they touch on a certain brain and make you move a certain way, possibly. So they don't perform surgery like neurosurgeons do. All right. So, but they do discuss that with the neurosurgeons, obviously, to see what they can come to and conclude if they need to do surgery of some type for the neurosurgeon to do. So, becoming a neurologist, they require more than 8 years of medical training. This typically includes 4 years of medical school, all right? 1 year as an internal medicine or medicine intern. They have to have 3 years of specialized neurology training in an accredited residency program. So, how is the epilepsy diagnosis given? Well, it begins with the neurologist reviewing your medical history. As a first step, they typically use standard testing, which I said earlier in the video here, is the EEG, electroencephalogram. This non-invasive test monitors your brain activity to detect seizures. So, the neurologist often work closely with your primary care provider to manage your seizures with medications. In most cases, medications help control seizures, but they often have side effects. So yes, medications can have side effects, obviously. We all know that. That's for any type of medications. It even has a warning on the bottle. May do not drive heavy machinery if you're using this, if you're not used to this or whatever, Now you ask, what is an epileptologist? All right, which I just mentioned just a minute ago. So an epileptologist is a type of neurologist who focus on diagnosing and treating epilepsy and seizure disorders. Epileptologists first train as a neurologist and then receive an additional 1 to 3 years of specialized training in the field called a fellowship. All right, so they do extra, and more likely they're going to do like 3 years. I think they do 3 years. I think that's required, actually, not for sure, but epileptologist has an extensive knowledge of type of seizures, their causes, and treatment options. So they understand the seizures and what their causes may be, and they have certain treatment options for people for people with seizure disorders or epilepsy and so on. Yeah, seizures are associated with epilepsy, but there are different over 40 plus different types of seizures. I mean, not even and some of those might not even be associated with epilepsy. So they also have specialized expertise working with difficult to control seizures or drug resistant epilepsy, DRE. So some further specializing in caring for children, older adults, or women with epilepsy. While not required, epileptologists usually seek board certification in neurology or pediatric neurology, which is good because just in case happen to have a work in the pediatric, excuse me for a second. Let me plug my channel in here at YouTube. It is My Brain Wreck. All right. So My Brain Wreck at YouTube.com. That's My Brain Wreck because I have a seizure disorder. I've been diagnosed with epilepsy or not just a seizure disorder. All right, let's continue on with what epileptologists are skilled in. Advanced testing procedures and analysis, such as video EEG, monitoring and single-fold high emission computerized tomography scans. So people that get video EEGs, that's actually pretty good to have. Now, remind you though, it's going to invade your privacy, to let you know. So, especially if you do it at home and stuff. They're watching every move you're doing and stuff. They want to make sure you're okay also, because if you're having a seizure or something, they catch that on video. Great, that's a good thing for them. Because they're going to watch your body movements and stuff like that. Like if you're kind of like something like this, or your arm, or jerking. I know myself, I do jerking at night sometimes, and I wake myself up all the time, every single time. And it's hard for me to fall asleep, and I don't know why. But once I do fall asleep, I'm asleep. But if somebody just barely taps me and pushes me, up I go. But video EEGs, I would say, be the best thing to have, because that way they can see what's going on, So hopefully they do catch something. Now, it's not a guarantee they're going to catch something at all, So it's hard. So don't expect to be getting something caught on your brainwaves or anything like that all the time. You just can't. They don't have control of that. Your brain is the one that does the work. All right? Your brain says, let's go ahead and have a seizure. No, touch your head, kind of blinking. And you'll see some people just kind of do a blank stare. And they might be aware of what they're doing. They can see what you're doing, stuff like that. There's all kinds of seizures. Absent seizures, focal seizures, tonic-clonic, which I believe mine are, because they're nighttime or whatever. I think that's what it is. I'm not mistaken. But, all right. Epileptologists are also skilled in helping to guide surgical decisions about removing the source of seizures or implanting neural stimulation devices. As I mentioned, neural stimulation devices like RNS and VNS, which I'll go into another video about that. We'll talk about that. Let's see if this is right for you. Or whatever. Not right for you, but like I said, this is just information I'm providing, okay, guys? This is just stuff that I'm learning myself. I'm not a medical profession at all. Seek any medical profession advice from your doctor, neurologist, epileptologist, or any other doctors that you see, okay? I'm just spreading this as information. So this is my disclaimer. Now, if you want to ask me something about criminal justice, go right ahead. That's where my background is in. They also look at latest developments in epilepsy research and treatment options. Now, recently, my video before this, they cut 57% federal funding for epilepsy research and stuff because of, obviously, you guys know what's going on, whatever, if you guys watch news and stuff like that. So that's sad and that's scary, and that can be scary for people and stuff like that, because that funding that they need does help with research and can help find a cure or help some type of leveling places out on somebody that has epilepsy or seizures, or it might help them level out their brain and stuff and not be so bad to have many seizures. They also managing anti-seizure medications and their side effects. And then we have what's called SUDEP. It's reducing the risk of sudden unexpected death from epilepsy. So it's just what it's called, just sudden unexpected death from epilepsy. Don't know what causes it. It was just from epilepsy. They're not sure how it could cause it, or they might try to find someone who did it, but they really don't know. It's just sudden unexpected death. Okay, now when do you see epileptologists? So many people with epilepsy can control their seizures with medication and support of their primary care provider and neurologist. They can work together hand in hand. More likely, your neurologist is going to provide you the medicine and stuff like that. But like I said, thank God for my PCP. He's very kind and great bedside manner, and he's a DO doctor, osteopathy. So he looks at the science side and the medical side. So he does both. So he likes both sides. So, however, about 1/3 of people experience drug-resistant epilepsy, which means medication cannot control their seizures. Yeah, that's 1/3. I mean, it doesn't seem like a lot, but when you have this over millions of people that live in the world, yeah. If you have tried 2 seizure medications at correct doses but continue to have seizures, epileptologists at a comprehensive epilepsy center can help. All right. I myself are on 2 seizure medications, which does help. All right. So, comprehensive education centers offer specialized services and have the team and resources you need. They offer the most advanced diagnostic testing and treatment, such as the RNS system, which I mentioned this earlier about RNS. All right. If you guys don't look that up, just look up RNS in epilepsy, and you can find RVNS, whichever ones you want to look at and compare what do they do, what it's for. So it's a good idea to consult an epileptologist if you want a second opinion about your seizures, epilepsy diagnosis, or epilepsy treatment. Okay. The National Association of Epilepsy Centers also advise you to see an epileptologist if you experience drug-resistant seizures, have unwanted side effects from epilepsy medications, have seizures that are not controlled after 3 months of care from your primary care physician, or 1 year of care by a general neurologist. Okay. Have seizures that are not under control after trying 2 or 3 different medications, are pregnant or wish to start a family, and have other medical conditions or factors that may be affected by epilepsy. All right, guys, so we'll continue this and we'll finish this on out here. So, like I said, I hope that you find this information helpful to you. Like I do, I'm just doing this research and stuff, and I look through Google and I look through articles and stuff like that. And I do give the credit to where I get this stuff from. So you ask yourself, what are the benefits of comprehensive epilepsy center care? So basically, evaluation by epileptologists can give you detailed information, including where your seizures start and what treatments might help you control them. Your seizures can start over here, back here, back here. They just don't know. Seizure can start from back here and start right here, and so basically your brain, like my title of my screen name here, my brain wreck. Your brain's a wreck. It doesn't know what it's doing. Everything's getting crisscrossed and switching sides and traveling the wrong pathways. That's why sometimes we have seizures and things like that. So this is one study of 200 people with drug-resistant epilepsy suggested that those who receive care from a specialized epilepsy center experience fewer seizures and more often seizure-free. Of course, individuals may vary. The difference was not related to the type of anti-seizure drug or drugs participants took, the study showed. So, epileptologists at the CECs can also help you manage epilepsy alongside other conditions or life changes, such as a disability or pregnancy. They work with you to reduce medication side effects, overcome treatment challenges, and improve your overall quality of life. So, now you ask yourself, well, so where do I find these places? How can I find an epilepsy specialty at a CEC? Well, there's the American Epilepsy Society and the NAEC list member neurologists, epileptologists, and CEC locations by zip code or state. You can also ask your primary care provider for a referral to a CEC or a special epileptologist, depending on what state you live in, if they provide it, if their state has it or not. But if you need guidance, there's a place. This is a place called Neuroeducators at NeuroPace. This is a place can help you find the next steps in your treatment journey. With a specialized care team behind you, you can reduce the impact of epilepsy and live the life you enjoy. Well, at least you can try to enjoy and stuff like that. But I know a lot of people out there that have epilepsy or seizure disorder are going to disagree with that. And true, every person's seizures are different and individual results will vary. Well, I hope this information helps you. I'm going to put this copy and paste this and put this into my YouTube video and stuff. All right, guys. Hope you guys get some information out of this, and this helps you some for those parents are trying to understand what's going on. Like I said, there's always epilepsy.com. That has lots of information there and gives you lots of resources, even to your state. So it's epilepsy.com. Thank you for watching my brain wreck. If you like my channel, like, subscribe, press that channel button press that bell button for more information. Make sure you click on all. The bell's highlighted all. Or click down on the bottom right hand corner of the screen there of your screen and click on the little brain there to bring a subscribe button that way, and subscribe that way. Make sure you click on all. That way you know when I post a video each and every time. And once again, this is just information providing. I'm not a medical professional or a doctor or anything like that. And as I said for one more time, my background's in criminal justice. So if you have a question for criminal justice, let me know. I can probably give you the answer to that. So thank you for watching. This is my brain wreck. You have a great day.